So next we come to the topic of pediatrics. In neonat Apgar scored calculation, epinephrine during neonatal resection, warthin, Finkeldy cells, necrotizing enterocolitis, MCC of HIV and its infection and its management in the newborn, Koplik spot images, greenish black stool bile pigment, Fontenelle's Dandy Walker malformation, newborn screening, delay in passage of urine, meconium, AIDS, enteropathy, baby born to HIV positive mother, metabolic disorder, alkaptonuria enzyme, hypokalemia, genetic disorders, tuberous sclerosis, features of ataxia, telangiectasia, color blindness, X-linked, pedigree, autosomal dominant disorder, Williams syndrome, X-linked disorder, Wiskott-Aldrich syndrome, fragile X syndrome, in CVS, preductal saturation in PDA, in fact, ductal closure postnatally, congenital closure postnatally, congenital rubella syndrome, coarctation of aorta, TOF, also called tetralogy of Fallot, fetal circulation. In GIT, Dublin-Johnson syndrome, indication for liver transplant in children, gastroschisis clinical scenario, protocol for diphtheria contact, celiac disease interception, clause sign, CHPS, management of diarrhea, plan B, dehydration. In CNS, test for congenital CMV, tuft of hair over lumbosacral region, ventriculomegaly newborn, criteria of NF1, feature not seen in CP. Most common manifestation of congenital toxoplasmosis, antibiotic prophylaxis, meningococcal exposure, Hitchcock disease, West syndrome, infantile spasm, measles, subacute sclerosis, panencephalitis, congenital hydrocephalus, renal and genitourinary tract, bladder extrophy, ectopia vesicae, minimal changes disease, tumor lysis syndrome, infantile hypertrophic pyloric stenosis, nephrotic syndrome. In hemat section, poor prognosis in ALL, viral infection causing transients aplastic anemia, inherited non-hemolytic unconjugated hyperbilirubinemia, HSP image and clinical diagnosis, sickle cell anemia, rickets, Hinoch, Scloins, purpura images and clinical diagnosis, Duchenne and muscular dystrophy. In respiratory syndrome system, features of child with cystic fibrosis, management according to IMNCI pneumonia, preterm babies respiratory distress syndrome, acute laryngobronchitis, pulmonary pleurothora, influenza vaccine ARDS Berlin criteria, foreign body in bronchus, growth and development, bidextrous grasp, habit disorder, WHO growth chart. In nutrition, quasi-core clinical scenario, dietary guidelines, energy from saturated fat, PEM, SAM, malnutrition, chronic. In endocrinology, most common presentation of CAH, over-testicular disorder of sex development, congenital hypothyroidism. In pediatrics, Neet 2023 topics which were asked were measles, biliary atresia, respiratory distress syndrome, hyaline membrane, RDS, cystic fibrosis, congenital rubella syndrome, cytomegalovirus, parainfluenza, laryngotracheobronchitis, croup, diabetic ketoacidosis, also called DK. Thank you.